Hello, my name's Becky Reynolds. I'm a Public Health Registrar in Yorkshire and Humber, and I was working at the West Yorkshire Health Protection Unit based in Leeds when I did this piece of work. This piece of work started when a member of the public phoned up the Health Protection Unit because he was quite concerned that he couldn't find any information out on the web about leptospirosis. The member of the public was a keen canal boat user, and he was quite concerned that if he fell off his boat into the water, he might contract the disease, and he wanted to know ways in which he could reduce his risk. So the consultant and I talked about the benefits of developing this concern that had been raised by the member of the public into a broader piece of work that would benefit a larger number of people, because we were aware that lots of people in Yorkshire and Humber use inland waterways, rivers, canals and lakes for all sorts of reasons, such as windsurfing, canoeing and sailing, and that there could be benefit of providing information about the small risk of infectious diseases through using those waters, as well as ways of reducing those small risks even further by developing this into a bigger piece of work. This project could benefit a larger number of people because there are a lot of different recreational water users in Yorkshire and Humber. So the next thing I did was to develop an assessment tool that I used to assess these 28 websites. The tool had a number of main questions. The first one was, did the website actually provide any information on infectious diseases? Next, if it did provide information, did it cover a broad range of diseases or just Fales disease? The third thing was, did it provide information to the members of the public about how they could reduce their risks? And I also looked at whether or not the websites provided links for members of the public where they could go to find more detailed information if they wanted to. So I used this tool to evaluate, to survey all 28 websites, put together my results, and then I sent my results to all of the websites asking whether they thought that what I'd found out was an accurate reflection. 9 of them responded and felt that yes, what I'd found out was an accurate reflection, but they all recognised that they weren't providing enough information to members of the public on waterborne infectious diseases. This was a really interesting piece of work to be involved with because it started from one member of the public expressing his concern and ended up with a project that benefited a much broader number of people. It used a whole range of public health skills such as literature searching, identifying that there was actually a need and a gap in some information that would be of great use to the public, engaging with a whole range of stakeholders, so engaging with different organisations including all of the websites, producing some information that was evidence-based, and then disseminating that to all of those organisations. These public health skills are very transferable both to different organisations such as local authorities and also to other public health topics, not just waterborne infectious diseases.